Cardiac surgeon warns this sleeping position raises stroke risk overnight. The core message of the original text is a stark warning that seniors are being actively misled by the medical and pharmaceutical industries about common, seemingly innocuous nighttime habits that are silently triggering heart attacks and strokes. Dr. Leonard Javier claims that for 40 years, vital truths have been suppressed, and that these hidden dangers could kill you while you sleep. He reveals that a common nighttime habit practiced by 89% of seniors over 60 triggers heart attacks between 2 SAU AM and 6 CAU AM when individuals are most vulnerable. A leaked internal memo from one of America's largest pharmaceutical companies in 2019, according to Dr. Javier, uncovered a direct link between this habit and 340,000 annual heart attack deaths in seniors, equating to 932 preventable deaths daily. Instead of publicizing this critical information, it was allegedly buried to protect an $89 billion annual industry that profits from treating heart attacks, not preventing them. Dr. Javier promises to expose 7 such nighttime habits and simple changes, clinically proven to reduce overnight heart attack risk by 67%, that go against conventional cardiological advice because the pharmaceutical industry has deliberately kept this knowledge hidden for decades. He urges those who believe seniors deserve the truth, not just what makes drug companies money, to subscribe and turn on notifications, asserting that only those who profit from suffering would refuse. This message is specifically for seniors tired of being lied to, tired of endless pills with side effects, and living in fear of sudden chest pain, encouraging them to subscribe and comment their age and location to demonstrate a collective awakening against these lies. Habit number 7, often overlooked even by doctors themselves, is taking blood pressure medication at the wrong time of day. With 74% of seniors over 65 on blood pressure medication, the common practice is to take it in the morning with breakfast as prescribed and labeled, a routine that Dr. Javier argues is literally killing people. The crucial piece of information being withheld is the natural 24-hour rhythm of blood pressure, which drops during sleep, nocturnal dipping, but rises sharply between 3 a.m. and 6 a.m. This early morning surge, driven by stress hormones like cortisol, is gentle in healthy individuals, but escalates into a dangerous spike in seniors with high blood pressure, particularly those over 70. This spike can rupture weakened arterial walls, dislodge existing blood clots, and trigger massive heart attacks while one is unconscious. The problem intensifies because morning blood pressure medication wears off by midnight and is completely out of the system by 2 a.m., leaving seniors unprotected during the most perilous hours. A groundbreaking 2022 study in the European Heart Journal, which followed 19,084 adults with hypertension for 6.3 years, revealed astonishing results. Participants were split into 2 groups, one taking medication in the morning and the other taking the exact same medication at bedtime. The bedtime group experienced a staggering 45% fewer cardiovascular events, heart attacks, strokes, cardiac arrest, and their risk of dying from a cardiovascular cause plummeted by an astounding 66%. The dangerous early morning blood pressure spike was effectively controlled in the bedtime group, while the morning group remained vulnerable. A 66% reduction in death simply by altering medication. Timing should have been front-page news, leading to immediate patient calls from every cardiologist and mandated label changes by the FDA. Yet, none of this happened because there's no financial incentive. Pharmaceutical companies cannot patent take it at bedtime or charge more for a timing change. Thus, this life-saving information remained buried in a medical journal largely unread by patients. Dr. Javier recounts the tragic story of George, a 73-year-old retired postal worker from Nevada, who religiously took his blood pressure medication at 7 a.m. for 12 years. His wife found him unresponsive at 5:30 a.m. after a massive heart attack around 4 a.m. George survived, but with severe impairment, using a walker and unable to drive. His cardiologist dismissed it as an inevitable part of aging, but Dr. Javier's review revealed that while George's daytime blood pressure was controlled, 24-hour monitoring showed massive early morning spikes, 180, 110 mmHg when his medication had worn off, leaving his heart completely unprotected. Neither his primary doctor, cardiologist, nor pharmacist ever mentioned bedtime dosing, highlighting what Dr. Javier calls medical negligence affecting millions of seniors. He advises consulting a doctor about switching to bedtime dosing for suitable medications like AC inhibitors, e.g. lisinopril, enalapril, ARBs, e.g. valsartan, candesartan, calcium channel blockers, e.g. amlodipine, and some beta blockers, e.g. carvedilol, emphasizing that specific situations require professional evaluation. If a doctor dismisses the idea, patients should present the Hygia chronotherapy trial from the European Heart Journal, asserting that ignoring such definitive, peer-reviewed research indicates a physician is practicing pharmaceutical sales rather than medicine. However, medication timing is merely the beginning, as habit number 6, something many are doing while watching this video, actively destroys arteries by creating microclots. Dr. Javier urges viewers, if they grasp the depth of this deception, to smash that like button, not for him, but for every senior kept in the dark and for every George who could have been saved. He explains that pharmaceutical companies monitor engagement, identifying content that threatens their business model, and massive engagement sends a powerful message that we're not buying their lies anymore. Every like is a vote against their practices, a statement that we know what you did, we're awake, we're not falling for it anymore. He implores viewers to share the video with other seniors taking blood pressure medication, emphasizing that algorithms will prioritize expensive cardiac procedure ads over this vital information. Habit number 6, practiced daily by 93% of seniors, is sitting for extended periods in the evening before bed, a seemingly harmless routine like settling into a recliner after dinner for 3 to 5 hours. During these motionless hours, blood flow in the legs dramatically slows by up to 50%, a condition known as venous stasis, a primary trigger for blood clot formation. While the body usually dissolves small clots, in seniors, especially those over 70 with existing cardiovascular disease, diabetes, or on certain medications, these clots persist, growing slowly. Upon finally standing up, as blood pressure shifts, these clots can dislodge, travel to the heart, and block a coronary artery or trigger an arrhythmia leading to a heart attack, often while one is completely unaware, brushing teeth. Research from the American Heart Association, analyzing 8,002 adults over 45, showed that those who sat for more than 10 hours daily had a 34% higher risk of heart attack and stroke. Crucially, it was uninterrupted sitting time that posed the greatest danger, with 4 hours straight being more perilous than 6 hours with regular 30-minute breaks, because even brief movements like standing or stretching restore blood flow and prevent clot formation. Every minute of motionlessness increases microclot formation by 2.3%, turning evening relaxation into years of plaque and clot accumulation. The emotional narrative of Patricia, a 71-year-old grandmother from Ohio, exemplifies this. Despite being active with morning walks and exercise classes, her evening routine involved 4 hours of uninterrupted TV. One Thursday night, she collapsed upon standing, experiencing crushing chest pain, a cold sweat, and difficulty breathing. Paramedics stabilized her, and hospital tests revealed a massive clot, a widowmaker in her left anterior descending artery, formed in her legs during her TV session and dislodged when she stood. Patricia survived due to quick ambulance response, but her experience was entirely preventable. Simply standing up for 60 seconds every 30 minutes, walking to the kitchen for water, or any brief movement to restore blood flow would likely have prevented the clot, saving her from a near-death experience, $87,000 in medical bills, and 6 months of cardiac rehabilitation. Her doctor never advised this because there's no billing code for telling patients to move during commercials and no pharmaceutical profit in movement. Dr. Javier recommends setting a timer for every 30 minutes during evening routines, standing for 60 seconds, and engaging in simple movements like walking to the kitchen or around the living room. For those unable to stand, shifting position, moving legs, flexing ankles, or contracting calf muscles is crucial to pump blood back to the heart. Ideally, breaking up evening sitting entirely with activity blocks, such as 6 to 7 p.m. for dinner and cleanup, 7 to 7:30 p.m. for TV reading, followed by a 5-minute walk, then another movement break at 8:30 p.m., prevents extended venous stasis, maintaining blood flow and reducing overnight heart attack risk by 41% with zero cost or side effects. A solution doctors should have prescribed but didn't due to pharmaceutical profit motives. Beyond sitting, habit number 5 concerns a dietary choice marketed as healthy that creates a perfect environment for overnight heart attacks, eating high-sodium meals within 3 hours of bedtime, whether it's a frozen meal, canned soup, takeout, restaurant leftovers, or a deli meat sandwich. Many consume 2,000–4,000 pRMLs of sodium in a single evening meal, exceeding the entire daily recommendation. If consumed after 6 p.m., this massive sodium load immediately increases blood volume as sodium retains water, leading to a retention of 3 extra pounds of fluid to dilute it, which floods the bloodstream and spikes blood pressure by 20 to 30 points within 2 hours. While this occurs when awake and vertical, gravity helps distribute the fluid. However, upon lying down to sleep, this excess fluid shifts, pooling in the chest cavity around the heart. The heart is forced to work harder against increased pressure, completely unnoticed while unconscious. The most dangerous aspect is that this blood pressure spike peaks between 2x a.m. and 4x a.m., precisely when most heart attacks occur. That seemingly healthy frozen dinner eaten at 7 p.m. effectively arms a biological time bomb set to detonate during sleep. A study in the Journal of the American Heart Association, tracking 2,983 adults over 60 with hypertension, found that participants consuming over 500 milligrams of sodium within 3 hours of bedtime experienced average blood pressure increases of 2314 mmHg during sleep, a 47% higher rate of nocturnal hypertensive episodes, BP over 140 90 mmHg, and a 3.2 times higher incidence of early morning cardiovascular events. Conversely, those consuming the same total daily sodium but finishing high sodium meals before 5 p.m. showed normal nocturnal blood pressure dipping, a 67% lower rate of sleep hypertension, and cardiovascular event rates similar to low sodium consumers. Same sodium, different timing, catastrophically different outcomes. This is particularly perilous for seniors because after age 65, kidneys process sodium 40% slower, meaning sodium ingested at 7 p.m. can still be present in the system at 3 a.m. when blood pressure naturally surges, creating a dangerous layering of dietary and circadian blood pressure spikes that arteries cannot withstand. Many wrongly assume they are careful with salt, but 77% of dietary sodium comes from processed and restaurant foods, not the salt shaker, as the food industry strategically engineers high-sodium products for addictive appeal. Dr. Javier lists healthy evening meals that are in fact sodium time bombs, frozen healthy dinners, 800–1,200 mg per serving, often 1.52 servings consumed, canned soup, 1,400–2,300 mg per can, deli meat sandwiches, 1,500–2,000 mg, Chinese takeout, 3,500 mg in a single meal, and restaurant entrees, average 2,400 mg. The cruelest trick is labeling these products heart healthy for being low in fat or cholesterol, while deliberately omitting prominent sodium warnings, a loophole facilitated by the FDA. Thus, a seemingly healthy 7 p.m. dinner leads to a blood pressure spike by 8:30 p.m., escalating to dangerous levels by 3 a.m. during the body's natural cortisol surge, potentially rupturing a weakened arterial wall, dislodging a clot, and stopping the heart, with families being told these things happen. He was 72, the heart gives out. Dr. Javier refutes this, stating the heart was poisoned by an industry that profits from your ignorance. He shares the story of Robert, 69, a retired contractor from Arizona who thought he was healthy by eating healthy choice frozen meals with a red heart symbol, as advised by his doctor. Unbeknownst to him, each meal contained 980 milligrams of sodium, and he typically ate 2, totaling 1,960 milligrams around 7 p.m. nightly. His blood pressure, normally controlled at 130/80 milligrams, would spike to 165.95 meteorologs by 8:30 p.m., a fact he missed as he only checked his pressure in the morning. One Wednesday, after his usual 2 frozen dinners, Robert died in his sleep from a massive heart attack at 3:17 a.m. The autopsy revealed a rupture in his left anterior descending artery, consistent with acute hypertensive crisis caused by blood pressure spiking so high during sleep that the arterial wall failed. His healthy frozen meals were, in fact, killing him. Dr. Javier advises strict rules: no meals over 500 milliliters of sodium after 5 p.m. Consume high-sodium foods at lunch to allow 7 to 8 hours for processing. Focus evening meals on fresh vegetables, grilled lean proteins, fresh fruits, and whole grains prepared without added salt. Controlling sodium in homemade meals. Read labels obsessively, ignoring healthy or natural for actual milligram counts. And if high sodium was consumed earlier, drink extra water in the evening, stopping 90 minutes before bed to avoid bathroom trips. This is about timing, as the body handles sodium better during the day when upright and active, but not at night when horizontal and recovering. One patient who made this change saw overnight blood pressure drop by 1911 mmHg within 3 weeks, leading to a reduction in medication, a free, side effect-free solution that doctors don't promote because there's no profit in eat dinner earlier. Alcohol isn't the only substance destroying cardiovascular health at night. Habit number 4 involves a specific food combination eaten before bed, mistakenly believed to aid sleep, but which, according to Dr. Javier, helps you sleep permanently. He urges anyone angry at the suppression of this life-saving information to comment, "Health is a human right, not a profit center," emphasizing that health has been commodified. He states that pharmaceutical lobbyists and food industry consultants monitor these comments, reporting sentiment to executives, and that thousands of comments are needed to show their monopoly is ending and their empire built on ignorance is collapsing. He challenges doctors who are offended to consider their complicity if they aren't educating patients on meal timing and sodium loads, reserving the refusal to comment for people who profit from suffering. Habit number 4 is combining alcohol with sleep medications or drinking alcohol within 3 hours of sleep, a seemingly innocent practice of having a glass or 2 of wine, perhaps a nightcap, followed by a prescription like Ambien or an OTC sleep aid. While alcohol initially feels relaxing by depressing the cardiovascular and central nervous systems 4 to 6 hours after the last drink, the body experiences a hard rebound. The sympathetic fight or flight nervous system surges, heart rate spikes, and blood pressure shoots up, rebound hypertension, increasing BP by 30-40 points. Adding sleep medication, whether prescription, Ambien, Lunesta, or OTC, Benadryl, melatonin, suppresses the brain's ability to regulate heart rhythm. Normally, the brain corrects irregular heartbeats, but these drugs dull that protective mechanism, allowing the heart to beat irregularly without intervention. This combination, alcohol rebound plus medication-induced cardiac monitoring suppression, creates sudden cardiac death syndrome, where the heart enters ventricular fibrillation, an erratic quivering that cannot pump blood. Unconscious from the sleep medication, victims don't wake up, feel chest pain, or call for help. They simply stop breathing quietly, assumed to be sleeping peacefully. A 2021 study in the European Journal of Preventive Cardiology, following 4,092 adults over 60 on prescription sleep medications, showed alarming results. Group 1, medication only, had an 18% increased cardiovascular mortality compared to the baseline group, no medication, no alcohol. Group 2, medication plus regular alcohol, saw a 73% increased cardiovascular mortality. The risk in Group 2 was exponential. 1 to 2 drinks plus sleep medication doubled the risk, while 3 plus drinks quadrupled it. Crucially, 84% of these deaths occurred between 2 a.m. and 6 a.m. during sleep from cardiac arrhythmias that never woke the victims. Autopsies revealed no massive heart attacks or blocked arteries, just hearts unable to sustain a normal rhythm due to the biochemical environment. These were not natural deaths from old age, but rather drug-alcohol interaction deaths mislabeled as peaceful passings. Dr. Javier asserts that pharmaceutical companies are aware of this interaction, documented in their clinical trials, but bury the warning, "Do not consume with alcohol," in tiny print within package inserts, never prominently displayed on bottles or in TV commercials. This suppression protects $4.1 billion in lost annual revenue, as prominent warnings would drop prescriptions by 60%. The alcohol industry likewise remains silent, protecting its own billions. Consumers are caught between two industries, profiting from their consumption while withholding potentially fatal interaction warnings. Margaret, 74, from Wisconsin, is a poignant example. She took Ambien for 8 years and enjoyed a glass or two of red wine, believing it heart healthy. Her routine was wine with dinner, 6:30 p.m., sometimes a second glass, 8 cal p.m., then Ambien at 10 cal p.m. One Friday, after 3 glasses of wine with friends, she took her usual Ambien. Her husband found her dead at 6 gal a.m., estimated death around 3 gal a.m., from sudden cardiac death due to arrhythmia. The medical examiner called it unfortunate but unforeseeable, a term Dr. Javier decries as false, as the interaction is medically documented, just not clearly communicated to patients. Margaret's husband lamented that had anyone conveyed the seriousness, he would have eliminated all alcohol. Dr. Javier states, "They don't want you to know how serious it is because knowledge would hurt sales." His advice: if taking sleep medication, absolutely no alcohol. If drinking, wait a minimum of 8 hours before sleep medication, making practical use impossible, thus requiring a choice between them. And if dependent on both, seek professional intervention. For those not taking sleep medication but drinking before bed, last alcohol consumption should be at least 4 hours before sleep. Limit to 1. Drink maximum, and never drink if under unusual stress or taking other medications. Better yet, eliminate both entirely. One patient who stopped his nightly wine plus Ambien routine saw his resting heart rate drop from 78 to 62 BPM and overnight blood pressure normalize within 3 weeks, feeling more rested, realizing the wine and pills were slowly killing me. Alcohol isn't the only substance destroying cardiovascular health at night. Habit number 3 is something 68% of seniors do within 2 hours of bed, marketed as healthy but triggering microclots, going to bed dehydrated. Most seniors avoid drinking water after 6 p.m., fearing nighttime bathroom trips, resulting in mild dehydration by bedtime and significant dehydration by 2 a.m. after hours without fluid. Blood, which is 92% water, drops to 88-89% water when dehydrated, drastically increasing its viscosity, how thick and sticky it becomes. Thicker blood flows slower through narrowed arteries and is more prone to clotting, with platelets sticking together more easily. During the early morning cortisol spike, thick, slow-moving blood is far more likely to form clots that trigger heart attacks. Dr. Javier likens it to pushing honey through a pipe instead of water, forcing the heart to work 3 times harder against plaque-narrowed arteries, eventually leading to failure. A study in the American Journal of Epidemiology, tracking 20,297 adults over 55 for 12 years, found that participants going to bed dehydrated based on urine-specific gravity had a 43% higher risk of heart attack during sleep, a 52% higher risk of stroke, and 38% higher overall cardiovascular mortality. This is tragically compounded by the fact that most seniors are chronically dehydrated without realizing it. After age 65, the sense of thirst diminishes by 40%, and kidneys become less efficient at conserving water. A study in the Journal of the American Geriatric Society revealed that 62% of seniors admitted to hospitals were dehydrated upon admission, despite reporting adequate fluid intake. The body silently desiccates, blood thickens, and no one warns because there's no drug to sell for hydration, just water, free water. Dr. Javier expresses frustration that doctors often prescribe medications for nocturia, waking to urinate at night, like anticholinergics, alpha blockers, or low-dose antidiuretics, which reduce urination but also further reduce total fluid intake, intensifying dehydration, thickening blood, and elevating heart attack risk. When a heart attack occurs, no one connects it to the dehydration caused by the nocturia medication, a situation he calls medical insanity masquerading as treatment. The correct approach, he argues, is to address the underlying cause of nocturia, daytime fluid retention, poor bladder function, sleep apnea, and optimize daytime hydration to prevent overload before bed. But this takes time and doesn't generate immediate pharmaceutical revenue. James, 76, from Texas, is a case in point. Terrified of waking to use the bathroom, he stopped drinking fluids after 4 p.m., resulting in dark yellow urine, a clear sign of dehydration he thought was normal. His doctor simply advised drinking less before bed, never explaining cardiovascular risks or checking hydration. One Tuesday night, after consuming only 12 ounces of water all day, far less than the recommended 64 ounces, James went to bed. At 3:42 a.m., his wife found him gasping, then unconscious. Paramedics revived his heart, but brain damage was extensive due to prolonged oxygen deprivation, hospital blood. Tests showed severe dehydration and markedly elevated blood viscosity. Cardiac catheterization revealed a clot, the consistency of jelly, in his right coronary artery. The cardiologist admitted dehydration made his blood so thick it clotted despite aspirin. James never regained consciousness and died 8 days later, a 100% preventable tragedy if proper hydration protocols had been taught. Dr. Javier presents a protocol. Morning hydration, 16 to 20 ounces upon waking. Consistent sipping to reach 64 ounces by 6 p.m., limiting evening intake to small sips, under 8 ounces after 6 p.m., and drinking 4 to 6 ounces 90 minutes before bedtime, late enough to hydrate, early enough to urinate once before bed. Additionally, emptying the bladder completely before bed and monitoring urine color, pale yellow in the morning, are vital. If nocturia persists despite proper timing, a urologist should be consulted for treatable prostate issues, bladder dysfunction, or sleep apnea, rather than assuming a hydration problem. One patient who adopted this protocol stopped waking 4 times a night and saw dramatic improvement in cardiovascular risk markers within 6 weeks, showing that front-loading hydration, not restricting it, is key. Dehydration is just one way blood becomes dangerous. Habit number 2 is a common sleeping position used by 71% of seniors, perceived as necessary or comforting, but which cuts off circulation to the brain and heart for 6 to 8 hours. Dr. Javier urgently calls for action, encouraging viewers to subscribe and turn on notifications because pharmaceutical companies and medical insiders actively suppress this content, flagging it as medical misinformation, even when backed by peer-reviewed research. He states that engagement, subscribe, like, comment, share, is the only way this information survives, framing it as a war for your health, for your autonomy, for your right to know what's killing you. He describes the enemy as having unlimited money, unlimited influence, and unlimited willingness to let you die for profit, but asserts that we have numbers and truth, and once enough people awaken, their empire will collapse. Habit number 2, sleeping on your right side or stomach, involves compressing major blood vessels to the heart and brain all night. When sleeping on the right side, the heart, slightly left of center, is compressed against the rib cage, reducing the blood volume it can hold. Simultaneously, the inferior vena cava, the major vein returning blood from the lower body to the heart, runs along the right side of the spine and gets compressed against the backbone, reducing blood return. This increases cardiac workload by an estimated 23% over 6 to 8 hours, a strain that can be fatal for seniors with existing heart disease, narrowed arteries, or reduced cardiac function. Stomach sleeping is even worse. The neck is twisted to allow breathing, compressing the carotid and vertebral arteries, primary vessels supplying blood to the brain. Doppler ultrasound studies show neck rotation beyond 45 degrees reduces blood flow through these arteries by up to 42%, and stomach sleepers typically rotate 60-80 degrees, essentially cutting off nearly half the oxygen to the brain all night, explaining morning fogginess, dizziness, and headaches. A study in the Journal of Clinical Sleep Medicine, tracking 1,024 adults over 65 with cardiovascular disease, monitored sleep positions. Right-side sleepers had a 29% higher rate of nocturnal cardiac arrhythmias, 34% higher early morning angina, and 41% higher overnight blood pressure elevation. Stomach. Sleepers showed a 37% higher rate of nocturnal hypertensive episodes, 52% higher early morning dizziness, confusion, and 48% higher transient ischemic attacks, ministrokes. In contrast, left-side sleepers demonstrated better cardiac output, more stable overnight blood pressure, reduced gravitational strain on the heart, and improved lymphatic drainage. This is simple physics. The heart is on the left, so sleeping on the left side uses gravity to aid blood return, and the aorta's leftward curve means the heart pumps against a reduced angle. This critical information, however, is not taught because there's no money and sleeping position advice. David, 68, from Oregon, a lifelong stomach sleeper, illustrates the danger. He developed morning headaches, dizziness, and blurry vision, which his doctor dismissed as allergies or mild sleep apnea after normal tests, never inquiring about his sleep position. 6 months later, David suffered a massive stroke at 4:37 a.m., resulting in garbled speech and right-side paralysis. The stroke, caused by reduced blood flow from compressed carotid arteries during stomach sleeping, had accumulated damage over years. His neurologist later stated that teaching him to sleep on his left side years prior likely would have prevented it, as chronic compression was visible on arterial imaging, building towards this for years, simply because sleeping position was deemed unimportant. Dr. Javier's protocol to protect yourself: primarily, sleep on your left side. To train, place a body pillow against your back, preventing rolling. Elevate your head slightly, 30 degrees, to reduce heart pressure and aid breathing. Keep your right leg slightly forward with a pillow between knees to prevent hip, lower back strain. If left side sleeping is impossible, sleep on your back with head elevated 30-45 degrees and a pillow under knees, ensuring your head stays centered. Never sleep on your stomach after age 60, as risks far outweigh comfort. If you wake up on your right side or stomach, simply reposition to your left. One patient switched after 50 years of right side sleeping, and within 2 weeks, morning blood pressure dropped by 14.9 mmHg and headaches vanished, realizing, "I had no idea something so simple could make such a difference." Your heart prioritizes physics over comfort, so choose a position that supports cardiac function. Sleeping position is just one factor. Habit number 1 is the single most dangerous thing seniors do before bed, normalized by society, recommended by doctors, and prescribed millions of times annually, causing more preventable heart attack deaths than any other factor: taking certain medications at bedtime that should never be taken before sleep. This habit, according to Dr. Javier, kills more seniors in their sleep than any other, occurring because doctors prescribe these medications for bedtime use without understanding or warning about catastrophic cardiovascular risks. He specifically identifies first-generation antihistamines, Benadryl, diphenhydramine, Unisom, NEPM medication, certain tricyclic antidepressants, amitriptyline, some blood pressure medications, especially short-acting calcium channel blockers, and certain painkillers, especially NSAIDs combined with other cardiac medications. These medications all have anticholinergic effects, meaning they block acetylcholine, a neurotransmitter crucial for regulating heart rate and rhythm. Blocking acetylcholine causes 3 dangerous effects: reduced heart rate variability, impaired cardiac conduction, and diminished blood vessel dilation. While compensatory mechanisms operate during the day, they shut down during deep sleep, leaving the heart on autopilot, an autopilot system now interfered with by medication. Around 3:04 a.m., as stress hormones, cortisol, adrenaline, surge for waking, the heart needs to respond by increasing rate and output, but it cannot. The medication blocks the signals. The heart attempts to beat faster, but fails to coordinate rhythm, leading to arrhythmias, often ventricular tachycardia or ventricular fibrillation, which are life unsustaining. Unconscious, victims don't feel it, don't wake gasping, but simply stop breathing, found peacefully dead in the morning, with families rationalizing, "At least it was quick. At least he didn't suffer." Dr. Javier unequivocally states, but it wasn't natural. It was pharmaceutical manslaughter. A study in JAMA Internal Medicine analyzed 10,000 sudden cardiac deaths in adults over 65, reviewing medication usage in the 12 hours before death. The findings were catastrophic. 58% of victims had taken at least one medication with strong anticholinergic effects within 4 hours of death, with 73% of these deaths occurring between 2 a.m. and 6 a.m. during sleep. Most victims showed no prior symptoms. Comparing medication timing, taking these medications in the morning carried a standard cardiovascular risk, but taking them at bedtime resulted in a 3.7 times higher risk of sudden cardiac death during sleep. The most damning detail, these implicated medications were often prescribed specifically for bedtime use, labeled "take at bedtime" by doctors, logic dictating that since they cause drowsiness, they should be taken before sleep. No one considered that drowsiness is a side effect of central nervous system depression, the very mechanism that suppresses cardiac regulation, likening it to prescribing a heart-paralyzing relaxant and being surprised when the heart stops. Dr. Javier calls this criminally negligent. Pharmaceutical companies know these risks. Clinical trials revealed increased cardiac events, but these findings were buried in secondary endpoints during FDA approval. Most doctors are unaware because pharmaceutical reps focus on efficacy and convenience, not cardiac risks. Even more sinister, many such medications are available over the counter: Benadryl, Advil PM, Tylenol PM, Unisom, with minimal warnings like "consult a doctor if you have heart disease," without explaining the risk of nocturnal cardiac arrest. Seniors, desperate for sleep, take these medications nightly for years, accumulating cardiac damage until their heart gives out. When families sue, pharmaceutical companies point to unread, ununderstood warning labels, claiming they warned you. Dr. Javier argues this is disingenuous, as patients cannot ask questions they don't know exist. This issue is personal for Dr. Javier, citing his uncle Richard, 72, a veteran who struggled with sleep. His doctor prescribed trazodone, an antidepressant used for sleep, with instructions to take it at bedtime. The label omitted trazodone's significant anticholinergic effects, especially in the elderly, and its potential for fatal cardiac arrhythmias when combined with other medications Richard took for blood pressure. Richard took trazodone nightly for 3 years. One Saturday, he took his usual dose, and his aunt found him dead at 6 a.m. from sudden cardiac death due to arrhythmia. Dr. Javier immediately recognized the combination of trazodone and his amlodipine, blood pressure medication, both taken at bedtime, as creating a perfect storm that suppressed cardiac function. His uncle's doctor stated she prescribed that combination to dozens of patients without problems, a claim Dr. Javier dismisses as ignorance of how many others died silently. Richard's death was not natural, but caused by a doctor's lack of understanding and a pharmaceutical system prioritizing profit over safety. To protect yourself, Dr. Javier urges a 5-step plan. 1. Gather all medications, prescription and OTC. 2. Look for ingredients like diphenhydramine, Benadryl, doxylamine, Unisom, amitriptyline, nortriptyline, and any medication with listed anticholinergic side effects. 3. If taking any strong anticholinergic medication within 4 hours of bedtime, immediately consult your doctor about switching to a non-anticholinergic alternative, changing timing to earlier in the day, or finding non-pharmaceutical alternatives. 4. Never combine multiple anticholinergic medications, as risks multiply exponentially. And 5. Immediately stop all OTC sleep aids like Benadryl or Advil PM, as they are dangerous for long-term elderly use. Safer alternatives include low-dose melatonin, 0.51 mg, 2 hours before bed, magnesium glycinate, 400 ml, 1 hour before bed, and general sleep hygiene improvements. One patient stopped nightly Benadryl, 50 mg, for 6 years and switched to melatonin, seeing morning heart rate variability improve by 34% within 2 weeks. Feeling more rested and experiencing normalized blood pressure. He realized Benadryl, despite being OTC, was slowly killing him. Dr. Javier debunks the lie that OTC means safe, asserting that acute safety doesn't equate to chronic safety in elderly patients, and that these medications are biochemically incompatible with safe sleep after age 60. These 7 habits, medication, timing, evening sitting, high sodium dinners, alcohol with sleep aids, dehydration, sleep position, and dangerous bedtime medications are not random or inevitable, but are the direct result of a medical system prioritizing treatment over prevention, pharmaceuticals over education, and profit over human life. But now, armed with this knowledge, individuals have two choices: continue in ignorance and complacency, hoping statistics don't apply, or take control. Choice 2 involves moving blood pressure medication to bedtime after doctor consultation, setting a timer for 30-minute evening movement breaks, eliminating high-sodium meals after 5 p.m., stopping alcohol with sleep medications, or eliminating both, smartly hydrating during the day and reducing evening intake, sleeping on the left side with proper elevation, and auditing all bedtime medications, demanding alternatives for anticholinergic drugs. These are not difficult or expensive changes, but require knowledge and commitment, which viewers now possess. Dr. Javier then makes a final, urgent plea: subscribe to the channel and turn on notifications to combat pharmaceutical industry suppression. Smash the like button to signal to algorithms and lobbyists that truth matters. And share the video with every senior, friend, family member, or neighbor over 60, explaining its importance directly, bypassing algorithms that promote pharmaceutical ads. He urges commenting on which habits will be changed, or if someone was lost to a preventable nighttime heart attack, reading every comment as part of a movement to reclaim health from an industry built on suffering. He promises to continue exposing lies and providing information, but only if viewers stay engaged, framing it as a war won by soldiers of truth. He teases the next video, revealing 5 healthy breakfast foods that trigger silent strokes, found in 87% of senior kitchens. Until then, he implores viewers to implement the discussed changes, respecting and protecting their hearts, as they have worked tirelessly for decades. He concludes by thanking viewers for choosing knowledge over ignorance, urging them to take control and stay strong and informed for future revelations.